work in 5 countries into a few slides. So I'm really just focusing on some of the themes that have come out. Each project worked quite differently in different countries, but there were some common themes across them, and I'm going to highlight them and give you an idea, a flavor of the project. We worked in India in 2 cities, Ghana and Tanzania, Peru and Brazil from Latin America, and recently we've started a collaboration with Asiya Tafuleni in Durban in South Africa. And we've worked with WIEGO's 4 sort of main sectors: waste pickers, street vendors, home-based workers, and domestic workers. And then in a couple of countries, due to the particular context, we worked with agricultural workers and market porters. One of the first things we did in each country was to really try and find out what health and safety problems informal workers face because of their work, and which ones are prioritized by informal workers. And then secondly, to do a more sort of institutional understanding of what were the particular blockages to extending occupational health and safety services to informal workers, and what pathways are there for creating change. And as a result of that, we've developed quite a few publications. Part of this is about trying to change the community of practice of occupational health and safety. And Francie Lund has been asked to edit a journal of progressive occupational health and safety called New Solutions, which we hope will have a big impact on the discipline of occupational health and safety to raise awareness of the needs of informal workers. The second theme is platforms for policy influence, which we worked on in these countries. These platforms, we call them, took different forms in different countries. So this picture is from the first ever national workshop on occupational health and safety of women workers in India, which was held by the Self-Employed Women's Association in Delhi. And they had a wide range of actors there, from the World Health Organization to the International Labour Organization, the Public Health Foundation of India, and the National Institute of Occupational Health and Safety. So this was a kind of platform where informal workers were able to talk directly to influential policymakers. In Durban in South Africa, we have a platform that has a slightly different role. It's about linking informal workers to municipal officials, municipal health and safety officials, so that they can do joint activities together in order to increase understanding between the 2 groups, and hopefully in that way work towards improving the actual condition of workplaces. And then design has been a big theme in India and South Africa. On the right, which I'll talk a bit more about now, are some of the work tools designed by the Self-Employed Women's Association in India. This is an embroidery stand, which was developed over a 2-year process with students from the National Institute of Design. And after the tools had been designed with WIEGO supports, they were commissioned a productivity study of these tools. And this was a particularly successful design. It was found to double the income of those workers who used it, decrease their back pain significantly, and increase the rate at which they could work, which is important with tools. If you can increase productivity and protect health at the same time, those are the tools that are most likely to be successful. These are sickles for sugarcane cutters that are much lighter and therefore put less strain on the body. These have been less successful than the embroidery frame. The plastic handles haven't been particularly popular. But some of the workers have reported a doubling in their speed of harvesting. And then this is an example of one that didn't work, and it's to emphasize the fact that this design process is a hit and miss sort of thing. It can go over a long period. But this is a waste picker cart that the designers and the waste pickers just couldn't agree on, and in the end it kind of just got left aside. So yeah, the design process doesn't always work, but it can be useful. And just to emphasize that in India, these tools get taken to a workers' welfare board, and in some cases the Workers' Welfare Board will adopt the tool and provide it at a subsidized rate to the workers. So that's the kind of where the advocacy goes after this with the tools. Network building has also been a big part of our program, and this is both amongst OHS professionals and amongst workers themselves. So these are pictures from a recent exchange visit that we organized between SEWA's community health workers and the Brazilian health system, organized by our very own Vilma Santana from the Federal University of Brazil.
Yay, Vilma!
And Brazil is a leading example of where workers' health has been integrated into primary healthcare services, and SEWA's community health workers are looking at better integrating occupational health into their work, and so we sent them over to Brazil so that they could learn more about it. But we also have networks from, particularly of OHS professionals from South Africa, Brazil, Peru, and India who have begun to correspond independently around this issue. And that's another network we would be looking to support. And then finally, one of the things we're getting into is participatory hazard mapping. And this is something from the linking platform in Durban that I was talking about. This is the herb market in Warwick Junction in Durban. And with CEO Tafuleni's staff supporting this, traders and the local Metro Fire Department work together to map the fire hazards in the market over a period of 3 or 4 hours. And we've started trying to experiment with mapping technology. So this is not only a useful sort of recording tool, it can also be used for advocacy purposes. And eventually we would like to have a situation where traders can send in messages through their SMS phones. So that's just a taste of what we've been doing over the last 5 years.